Okay, here we are live on Thursdays, Therapy Thursdays, everyone. My name is Dee Garza. I'm here with Epic Consulting hosting this space. And I'm going to hand it over to Kanuli Martin to kind of show us or tell us why we're here.
All right. Well, we are here for Therapy Thursdays. Thank you so much, Letty, for bringing us on. We are Child Guidance Clinic, Henrietta, Weill Memorial Child Guidance Clinic in Adult Behavioral Health. We are at the Delano site. That's at 375 South Dover Parkway. And we are so glad to join you today to talk about, to commemorate May as Mental Health Awareness Month. And today we're so excited that Lupe Juarez is going to be our presenter. And we are speaking today about, again, depression, but going into part 2. And so we also have the lovely Paula, who is an intervention specialist at CGC Delano, Marcela Lopez, who is a licensed clinical social worker. We have the very lovely Natalie, who was with us last week, and Isaac, our board member. And then we have Lupe, also licensed marriage and family therapist. So we are so glad to be able to join you today.
Thank you so much. Just a quick reminder why we're doing Therapy Thursdays, Mental Health Awareness Month. There are resources available everywhere, but we're providing this space just to have a consistent space for this conversation and to support your local clinic and your to your locations. I'm going to hand it over to Lupe and I'll pull up some slides.
Great. Good afternoon, everybody. My name is Lupe Juarez. I am a licensed marriage and family therapist with Child Guidance Clinic at the Delano Clinic, like our fearless leader just explained. I know you guys received a lot of information in the last, the last Therapy Thursday session. I'm here to give you guys a little bit more, and hopefully we can have a conversation about what's really going on in the world and how depression is affecting our lives today. Go ahead and change the slide, Letty, please. So I'm just going to give you guys a couple statistics. Depression is the leading cause of disability in the United States among people ages 15 to 44. And when we say disability, we really mean disability because it can be a very debilitating mental disease to the point where you can't get up. You don't have the energy to move. You don't enjoy anything at all. So, it really is a disability. While major depressive disorder can develop at any age, the median age of onset is 32 and a half years old. Makes sense, right? Middle age, Stuff is happening. Life is changing. There are a lot of expectancies, a lot of pressure, not only from yourself, but from the world. Numbers from the World Health Organization estimate that about 350 million people have depression globally. And this is in all varying, degrees or severities. So we're going to get into a little bit more specific cultural and socioeconomic status stuff. Black and Hispanic Americans are more likely to meet criteria for major depressive disorder, according to the CDC. MDD rates in African American communities are less than the overall US population at 9.5%. 16%, which equals to 4.8 million of Black and African American people reported having some kind of mental illness. Serious mental illness rose from 4% to 6.4% in Latinx or Hispanic people ages to 18 to 25, and from 2.2% to 3.9% between the ages of 26 and 49. from 2008 to 2018. So that's a pretty high jump. Stigma and judgment prevent Black, Indigenous people of color from seeking treatment for their mental illnesses oftentimes. Bilingual patients are evaluated differently when evaluated in English versus Spanish. And Latinx or Hispanic people are more frequently undertreated than our white counterparts. The CDC statistics also show that people with less education, less economic stability, and less insurance coverage are more likely to meet the criteria for major depressive disorder. And all of this makes so much sense, you know, when you sit back and think about it, because when your priority is surviving, how to get from one day to the next, you're under a great deal of stress. You don't know how to deal with it. And you really don't have anywhere to go to for help. A review of the effects of marriage and divorce on depression by the U.S. Department of Health and Human Services found that marriage consistently lowers the risk of depression, of depressive symptoms in both men and women. Marriage is a happy thing, right? When we're happy, we're not feeling too down. But research also consistently shows that divorce increases the risk of depression and depressive symptoms. Again, this makes very much a lot of sense, because when you're going through a divorce, things probably aren't going too great. Many studies have shown that depression can be passed down through families. If an identical twin has major depressive disorder, the other twin is 50% more likely to have MDD. If a parent has depression, the chance of the offspring having depression is also about 25%. Adoption studies show that a child adopted by a parent with depression also has a higher risk of experiencing depression or depressive symptoms. This I found very, very interesting, because it indicates, or, you know, to me, it shows that not only could there be a genetic component to depression, but it could also be a learned way of coping, a learned way of reacting to life stressors. Two out of 3 people with depression do not actively seek nor receive proper treatment. Which is interesting, because even though they won't seek treatment, even though up to 80% of people with depression respond to treatment within 4 to 6 weeks of being in therapy. That to me is huge. 4 to 6 weeks is nothing in therapy. Mm-hmm. Up to 50% of people who do not respond to treatment fail because they stop getting treatment. Oftentimes we are told in school when we're, you know, studying to go into mental health that we have to trust the process. This often has to become our mantra with our clients as well, because if they don't trust the process, the rate of change is not fast. It's actually pretty slow. Mm-hmm. So if they don't trust the process, and if, you know, you're not really willing or ready to work at it, it can be a very frustrating, almost hopeless experience.
Sorry, I had my mic muted. Of course I did. Thank you for going through those slides. Can we jump back a little bit and talk more about the adoption and those coping skills, or the maybe the learned behaviors or whatever? I thought, because to me that was a really interesting statistic, and I don't work in this field, so I didn't never consider that might be the case. So can you talk a little bit more about that?
Yeah, so I think throughout my treating families, you know, just during the assessment process, in order to do a good assessment and understand where a client's symptoms are coming from, you have to know a family history. Oftentimes we'll see that if our clients are experiencing certain symptoms, there is often a family history of them. And so specifically with depression, I think it's easy to attribute it to a genetic component. Maybe it's passed on through genes, but the adoption study, I think, really highlighted that parents really teach their kids how to confront or how to cope with life stressors, with difficult situations, with loss, with grief, with every thing that can really trigger one of our depressive episodes. And I say depressive episodes because they can sometimes come and go. And so with that adoption study, we're seeing, or to me, it seemed like it cannot just be genetic. It's indicating that kiddos are learning from their parents that depression is a reaction to something severe happening. So they can oftentimes mimic the way that depressed parents react to difficult situations.
It's that whole thing we talk about, nature versus nurture. So nature being, the chemical process, what's going on in the brain, and nurture, what's going on in the environment. We always say this share with our parents that they need to model a certain kind of behavior if they want their kiddos to follow after that behavior. They can't tell their kiddos don't smoke marijuana if they are downing several glasses of wine at the end of a hard work day. It's modeling the opposite. And so I think that there's this whole theory about behavior. What is our behavior? How do we respond in situations? How do we cope with situations? And we know that depression is more than behaviors, but the slide about adoption, it does seem to indicate that environment has a lot to do with how a person experiences depression and their response to the downs. So,
I think that's important to note also, and the reason why I think that you wanted to highlight also socioeconomic and racial differences between people and how depression is affecting them culturally within the culture, but then just in society in general. It's interesting because I had a conversation with someone, and we were talking about health related programs, and I made a comment about because alongside this Thursday night, on Mondays we're doing a book conversation on So You Want to Talk About Race. So there's a whole 4 months worth of race topics. And I said that maybe that was, something that had to do with what they were working on, these health related issues, which include mental health. And they were kind of dismissive about it. But I feel like, given the statistics that you shared and what we know just as human beings in the way that we're dealing with stress, and if inequality and systemic racism is something that you deal with every day, how can that not affect you physically?
So there was even, I don't know if you guys remember this, but from Stacey Kawahara, who is she's kind of the captain of the whole deal. She's the director of our Kern Bears Behavioral Health Recovery, which is our county, our parent company, so to speak. And she sent out an email saying that racism is now considered a national health crisis. And so it's impossible to face societal ills as, a marginalized community or a BIPOC person and not be impacted by those stressors. For example, don't really want to bring this up, George Floyd. I told you about how I have outlawed and banned the whole Law and Order, SVU, my favorite TV shows. Like, I have to monitor what I'm watching. Still haven't watched that video because I know that that's that's very triggering because it's a person, you know, in my particular community. But just really your heart grieves for anyone who is suffering, no matter what community they're from. And so absolutely, environmental stressor can impact depression. I'm actually, one thing that we didn't talk about last week was situational depression versus like chemical depression. And this is kind of what we're talking about, the situation in people's lives, loss, we're talking about, or Lupe, like you mentioned, at a certain age, you're going through different stressors. So it makes sense that at 32, you're middle age, bye-bye are the glory days. Glory days are done. You have to pay bills at 32 as opposed to 22, life changes. So, that situational depression can actually, if a person does not rebound, if they are unable to be resilient, then the chemicals in the brain begin. This is what research will say. The chemicals in the brain will begin to respond to a person's situational distress and will lead to then what we call now chemical depression. And when I say whether it's situational depression or chemical depression, let's say situational depression, I don't think anything is wrong if someone is like, I need to get on some medication to help, while to help me walk through it. But when it shifts into, the depression is now chemical, where you don't have the dopamine or the serotonin levels won't bounce back, or they're very low, then at that point you really need medication to just even get out of the bed. So whether it's situational based on, being a BIPOC person or a person in poverty, or if it is based on, if it's depression based on chemical, at some point, depending on how severe and pervasive it can become, medication can be indicated. So that's why we want to get on top of treatment when we can.
Yeah, and I wanted to pull up this bullet point. Depression affects more than 23 million Americans every year and is the most common serious brain disease in the United States. Can either of you or someone else maybe share the answer? What does serious brain disease mean?
I actually really appreciate that they phrased it that way. Mm-hmm. To highlight the fact that it is a physical illness. Mm-hmm. It's not just, oh, she's sad,
blues, right.
She's got the blues. It's not just a situational thing like Kanuli was saying. It really does affect you physically. Mm-hmm. It's a serious brain disease because, like Kanuli said, it's an imbalance of the appropriate hormones in your brain. Mm-hmm. A lot of people like to highlight that emotions don't come from your heart; they occur in your brain, right? And they are caused by those chemicals, the serotonin levels, the dopamine, even endorphins. All of these things they're happy chemicals in your brain. Mm-hmm. And when your brain is sick, for one reason or another, it just can't create those chemicals. Mm-hmm. And that is why I appreciate that they're calling it a serious brain disease.
Yeah.
In addition to that, oh, sorry, go ahead.
No, go ahead, please, Marcella, please.
Piggybacking on the brain disease, I mean, we have these imaging scans where you can see how the changes in the brain. I mean, the depressed brain, the hippocampus is actually shrinks compared to the normal person. So obviously, we process information, emotions differently. So it's that linkage as to our reactivity being different compared to the other person who may not be experiencing these kind of stressors. I mean, the hippocampus manages or regulates our emotions and memories. So if it shrunk significantly, I mean, for us to experience positive emotion.
Mm-hmm. Mm-hmm. You've made a very good point, and it kind of made me think about just neurons firing. If we're gonna go if we're gonna go that route, if our brain isn't producing the right amount of chemicals, then how is our brain isn't functioning at the rate of somebody who doesn't have depression. It's you're not able to think clearly. You're not able to think as quickly. You forget things. It affects not only your emotions, but your overall functioning.
That's right. That's right. And I think we do people a disservice by saying things like, just snap out of it. Just get out of bed. And I mean, it just like, for example, we call it it's called serious brain disease. It's like like heart disease, or I'm thinking of something like diabetes. Like with diabetes, you can't just say insulin work. I mean, you have to treat it with medication or with food. You have to manage it with food. Like your physical body is impacted because of the disease. And it's the same with depression. It does, just like Lupe was saying, it affects every aspect of your everyday life, because it's not when we're talking about serious brain disease, it's not it's just the blues. I'm feeling the blues because it's the holidays. I'm missing my family, or I just needed a couple days to cry. It really impacts every aspect of your life, your social life. You don't want to talk to anybody, your work life, calling out for days. Some people really, true major depressive disorder, some people, they have to get on certain insurance because they're not able to work because it is so pervasive, can be.
Yeah, that kind of takes me back to the way that they called it a debilitating illness. It really can be debilitating. When people have a heart attack, you don't tell them, hey, shake it off, get back to work.
Right.
So why are we telling people that when it comes to depression?
Absolutely.
So we have a comment along those lines. This is Melissa French. This is great information. There's so many stigmas in our culture about mental health. And on one of the slides where we did talk about race as one of the issues, or culture as one of the issues that prevents people from getting help, do you find that in your work, especially, I mean, we're focusing on the Child Guidance Clinic part of this, is there a stigma? Do you have a hard time with families once they're referred?
Oh, yeah.
Everybody's shaking your head.
Absolutely. And I think that's something that really comes up periodically throughout the year within our agency. Kanuli has done a really good job of recognizing that there is a huge stigma, a negative cloud around the idea of mental health. We have a lot of parents who say, that's for crazy people. My child isn't crazy. And, I think that personally, I've spent a lot of time with people during assessments, with parents, families, explaining exactly what these different mental health illnesses are, how they affect the body, how they come about. And I'm very happy, because once people really understand mental health disorders as a physical illness, as something that is a health issue, they're much more likely to not only support the therapeutic process with their kids, but also they ask for individual sessions themselves, which I personally find to be just so wonderful.
Yeah, that's great. Yeah, it's understanding the why behind, right? I mean, I know this is something that we've talked about a lot. And actually, with the person that I was talking to about the race-related health issues, just in general health issues, they need that underlying why. Like, why do I need to change my diet? Why do I need to exercise? Why, as a community, do we need to make these changes so that it's more equitable and accessible to everybody? Everyone's on board. You're checking up on each other. That's awesome. That the parents will see that the value in that, and then use it for themselves as well. That's amazing.
Yeah.
I think that this idea, the 1 in 10 Americans say they have depression. I don't know if this statistic was because they've gone to therapy and they feel depressed. Is there anything you want to add to this particular statement? I think it's sort of the same as the 23 million. I think the statistics kind of line up in that way.
Yes, I'm actually looking back, and I want to say that we kind of touched on how depression can have varying, levels of severity. A lot of people, I think, misuse the word depression because we can have a day where we're in a bit of a depressed mood, but we don't quite we don't quite meet criteria for a depression diagnosis. So I think that can kind of be misleading, maybe. I don't know if it really does, or I don't know if it does line up with the statistic of how many Americans have depression. However, I do think that it's staggering, and it kind of makes you scratch your head and think, if that many people are saying I have depression or recognizing these symptoms, but still 2 out of 3 won't seek treatment. It's recognizable, but you won't ask for help. That's the thing that sticks out to me.
It's okay to say. It's like it's okay to say I'm depressed or I think I have depression. It's okay to say like you just brush off. That's the line, right? Yes.
Something that stuck out to me, I think people won't seek seek treatment is because of the stigmas, and not just, BIPOC people. It could be you have, we know stars who are, smoking it up, taking drugs, and people on the outside would be like, what are you depressed for in your sprawling mansion? You have everything at your fingertips. So sometimes it's the idea of, I shouldn't be depressed, or the lie that you have a choice in this, that I can control it. Like it's, people don't get that it is a physical, that it can be a brain disease, a serious brain disease, that it's physical, and they're just like, hey, just shake it off. And I think sometimes that's why people aren't getting the assistance. And it goes back to that thing of also of culture. I was sharing, I don't know if I shared this with my staff, with you guys, but when my grandmother died, I was depressed. I met the criteria, and it's, really it was complicated grief. But because I didn't have the sadness, but I had that, the loss of pleasure. So you have to have either the sadness and or the loss of pleasure versus, as well as other symptoms. I didn't have the sadness, but the things that I used to like to do, I didn't like to do. So I would sleep for like 12 hours at a time. And I'm like, I gotta go to the hospital. I have this dreaded disease. And I went to go see one doctor, and he said, are you, how's your sleeping? I'm sleeping 12 hours a day. What about, how's your concentration? I can't think, I can't focus. Well, what about your eating? I'm overeating, and then I won't eat for days. And then he went through this checklist of what about this and what about that? And I had, that psychomotor retardation. I'm like, yeah, I was so happy that someone was telling me what was wrong with me. Obviously, this is before I got my master's degree and got into the field. And he said to me, you meet the criteria for depression. I'm like, I can't be depressed. You don't understand. And for me, it wasn't because I'm a member of the BIPOC community. It's Christian. And, my brand of Christianity was depressed. Why are you depressed? You have Jesus. You gotta,
right.
read out. You gotta pray. You gotta stand on the word. You gotta fast. You got, join the prayer line. Get on prayer. And so sometimes it is not just the culture, as we're talking about ethnicity. It could be the culture of your family. Your family is like, we're the Joneses. The Joneses don't get depressed. We don't have, we don't have time for that. So sometimes I think that's why people may not seek treatment. It can be an issue of pride in their family name, or, like I said, my culture, it's like you gotta figure out another way out of it other than treatment. And so that's probably why I think that number is It's really bad.
I think it's also.
Oh, sorry. Okay, go ahead.
No,
and
go
then
ahead.
I have a comment.
One thing I just wanted to mention is that Kanuli's absolutely right when it comes to the culture within your family. One of the things that we see specifically in, or that I see specifically in the clients that I've seen, is that I've had kiddos tell me, my parents had it way worse. I have no reason to be depressed. I have a roof over my head. I've got clothes on my back. I have both parents, and I live in the US and I'm not struggling to survive. Why am I depressed?
Yes. I shouldn't be. Or
Yeah.
Or and to add to that, this idea of, I'll call it false resilience. In other words, parents also tend to label their kids as lazy. Also, the idea of, what do you mean you can't get out of the bed? Or what do you mean you're depressed? We're all depressed. We just make it even though we're depressed. Like, we're all feeling down, but we just get up anyway. Like, just wanted to add that.
Yeah, Marcela, I was going to actually say that a lot of the things that those kids are saying are because, and I'm going to say we, because I was told those things, that there's like this line that you don't cross. And when you're talking about being sad or being tired or needing something, especially if it's a more of an emotional kind of a thing, it's like, that's what we're told. You're going to add something?
Yeah, it takes a while. I mean, we really need to educate because it's just that misinformation, like we've already discussed. And it goes back to, obviously, that stigma and the misinformation.
In terms of maybe along the lines of a coping skill, I want to bring this up because then we're going to move on to a sort of a different topic along those same lines. But this is Melissa French wrote back. I'm not going to read the whole. I've already read the whole thing, but she's talking about her father, and she's noticed in the evenings when the evenings approach, he becomes more symptomatic. What are some things we could do to help him in the evenings? So lost his wife and became an amputee, so he's lost mobility and his independence. So before we move on to the next topic, is this because we're talking about 1 in 10, we're talking about 23 million, we're talking about serious brain disease and chemical imbalances. What are some things maybe that we could offer?
I just wanted to just make one observation, and then you guys feel free. I find that when I had a client who she was, I think at age 50, all these years she was fine. And then at age maybe 55, she lost her job. And then this is in Oklahoma when I was doing counseling therapist in Oklahoma. And she came to see me and she's like, all of a sudden I'm depressed. And so as we combed through her life, she talked about, a lot of trauma she suffered as a teenager. But when she was like 20, she started hitting it strong. She had a job. She was working. But what happened was when she lost her job, she had time to focus on the stuff she didn't have time to focus on before. And it makes me think about this same situation becoming more symptomatic in the evening. Well, the evening is when things wind down. In other words, you can't distract yourself with busyness and activity in the evening. That's when you start you can't push aside the thoughts of, I'm sad. And so I just wanted to add that before if you guys wanted to share some skills.
I definitely can see exactly what it is that you're talking about, Kanuli. I also think that, it's the evening time. It's the afternoon where he would possibly have dinner with his spouse, spend time with them, and then go to bed. And so it's really those times that he's probably missing her the most. And so, my sincerest condolences for his loss. Wow, as far as coping skills, I think that maybe I'm a big I'm a big proponent of routine and of support when it comes to depression and its treatment. One of my thoughts could possibly be maybe as a family, we can take turns and we can FaceTime, or we can check in and say, hey, how was your day? Just to give him a little bit more of support in those afternoons.
Yeah. Also,
go ahead.
I'm sorry. Also, what that made me think of is something to look forward to. Like at the end of the day, I have this, my love of ice cream and hot food, but something to look forward to as they wind down. Just wanted to add
That's good. That's good advice. And I know we went through a lot of coping skills last time. But when people are asking in the moment, I think it's good to
Did anyone have something else they wanted to share real quick about a quick coping skill they can offer? Paula, Marcella, Natalie.
I can see the wheels turning.
It's quite interesting establishing the routine, because also we got to be mindful. I don't know how his sleep patterns are like, so that can contribute to the possible even lower motivation or lower mood. And maybe even journal if it feels comfortable doing so.
Yeah.
And being practice self-compassion, because we, during the might go through feeling starting a level of guilt as well. So be accepting of the process, in the sense that you take the reasonable responsibility of the situation. Don't overdo it.
Yeah.
I would also very much recommend that, he get hooked up with a clinician of his own, so he has that support as well. If we were working with him individually, we would definitely try to get to know him, his hobbies, the things that, maybe make him feel like he's a little bit more connected to the person that he used to be, and help him find ways that he can still be that person, even though he has had different types of losses.
Yeah, for sure. Right. And that's a good point. It's not just one loss, his wife passing away. It's a loss of mobility. And I like that idea. Who was he before? I think someone mentioned this nighttime routine. So, sometimes the idea of structure is really healing, because, this is going to come next no matter what. And then I'm thinking like family game night, like, certain nights you guys have an opportunity to just, koinonia, that idea of fellowship, you get together. Well, if you're not the arguing kind of family, if it's good fellowship, families can come together and, have game night, opportunity to connect.
As long as it's not negative arguing, a little ruckus isn't gonna, sometimes a little ruckus is good for us.
If no one flips a table over.
Yeah. Right. No one's going to jail.
No violence.
Good night.
Okay, this is something I want a bit of conversation about this going. Depression is twice as common in women as it is in men. And could you maybe explain why, if it's because more women get help, or is it just a statistic that happens across the board no matter what?
Yeah, I don't want to overshare, so you guys, feel free to chime in. But what was funny about this statistic is that the website that it came from identified hormonal fluctuations as a reason for the depression. And so I've actually heard this twice, that what happens is before a woman starts her cycle, she, whereas a guy, he'll go, this way with his emotions, but with women, they'll start here, and then when their cycle starts, it's like here, then they're great, and then they're not so great. And then when they start, menopause, it goes back to the same level of, stability and emotions. So people say it's the hormonal fluctuations. List that as a cause. We can also, okay, we're not bashing dads, but moms are miracles. Okay, they're miracle workers, and one thing is they carry on the burden of everybody in the family, and also we're not really great about our own self-care. So I would list those two possible reasons as to why it's higher for women.
When I read that, I thought, oh wow, so many factors. And one of the first things that popped into my head was, women have the opportunity for postpartum depression that men don't.
Yeah.
And that kind of goes back to, hormone levels and, childbearing and all of that. So I think that that's definitely one of the contributing factors to why women are twice as common or twice as likely to have depression as men. I think if we go back to culture, oppression is in women is actually another thing that can really cause you to be depressed, feeling just kind of stepped on all the time,
Yeah.
Funny you say that.
Be another factor.
Because I was going to say the patriarchy was part of the problem. Just the system that exists in our country and how, because it can be culturally meaning, ethnic group culture, but also just the culture of America in general, and individualism and all of those things, that we've created a situation where you can say this and people will be like, well, those women. And then that's the end of the conversation, instead of everything that you guys just said and how all of those things factor into the idea that this is probably true, but there are so many things that women are dealing with that men will never encounter. So it's not really fair. So there has to be that education alongside it. Right.
I also think it's fair. Ever since the beginning of, ever since the times of Freud, Freud was one to bash on women and say we were hysterical, right?
Penis envy, everything was, your mother caused it all. Yes. Absolutely.
Women are just the root of all evil, apparently. So I also think that just since the inception of therapy, it's also become a lot more acceptable for women to seek mental health treatment than it has been for men. And I do have to give them that credit. I think that Letty, you had a very good point in saying that women are more likely to seek treatment. And I think that it's because of back to the same patriarchy, the idea that, oh, you're a man, you have to suck it up and pull yourself up by your bootstraps. And that could also be one of the other factors. It could be a misrepresentation.
Absolutely. I like that because I think in our culture, we do not socialize men to cope with their emotions in the same way. From a kid, be a big boy, but the little girl, oh, dad, go see your daddy, mom, kiss it, make it all better. But men, they don't get the same grace. It's, suck it up, cowboy up.
And they're more decisive.
What's that, Marcela?
They're more decisive because if you look at it carefully, for a reason, we have higher number of completed suicide attempts within men compared to women. Women have higher, they have completed suicides, while women have 3 to 1 in suicide attempts. So they'll take a more decisive route to their situation and emotions.
I told you it's the patriarchy. I'm not backing down. Okay, so we're going to take another little shift and now focus our attention on children, which I think, am I wrong, that the majority of your clientele is kids? And I'm going to go back to the slides real quick because and I just came across this. I'm not sharing my screen, sorry. I I came across this documentary, and it's a couple years old already, but when we're talking about depression in children, this American tragedy is about Columbine, and it's about Dylan Klebold, one of the shooters. And whoops, here's the description of this is the description of the film. So on April 20th, 1999, Columbine High School was under attack by Eric Harris and Dylan Klebold. And this movie follows the mom, Sue, in her attempts to reconcile how the son she thought she knew, the son she loved, could willingly be a school shooter. And she says, if love could have stopped Columbine, Columbine would never have happened. And then they pose these questions about what would real prevention look like, if it's even possible, and like, are we ready for it as a country? And it's a lot of the things that we're talking about kind of dismantling some of the stigma and what's really necessary and important for people to have to cope. And this might be a little triggering, so I'm just gonna go ahead and give you the warning. I want to play the trailer for this. I watched the documentary just yesterday, and I remember this. I was 24 when this happened. And I don't know how it's affecting anyone watching and any of you. So just like a heads up. This is available on Amazon Prime. So if you have access to that. And actually, I don't know if the sound is going to be on. Sorry, everybody. There we go.
I mean, I thought I was just the greatest thing because look at this kid. Does everything right.
Two young men apparently dressed in long black trench coats opened fire.
How does someone go from being the least violent person to committing mass murder?
The first thing I want to know is where were the parents? What were the parents doing?
Where the hell were their parents?
We don't want to hear that, yes, your kid actually can make a bomb in the garage and you might not notice. You know, it would take years for me to put all this together to understand really what happened.
Whatever lessons we should have learned from Columbine, I would say unfortunately we did not. And that's why we keep repeating this very uniquely American tragedy.
They were killed by my son and his friend. And that's the horrible, hard part to live with. This is what I wish I had done differently.
That was pretty tough. Did you guys get a chance to see that?
I did, yes.
What were your thoughts about it, Lupe? I didn't watch it.
You didn't? I was hesitant because it can be really triggering. Especially because we had talked about it with Letty, and she said that it did focus on the parent of one of the shooters. Yes. And so I think that it was really enlightening, very interesting to hear her perspective, because the media did paint a very different picture of these adolescents. Yeah. And I think it really highlights how when something this big happens, there's always someone to blame. Everyone's looking for somewhere to point their finger. And, historically it's been, how did parents not know? Right. What did you do to your kid? Yeah. Or you didn't get him mental health treatment. And then it becomes, world mental health isn't doing their part. And then it becomes a gun control issue. One thing that I found really interesting, though, is that, everyone gets up in arms and we need more mental health treatment and we need to pay more attention to our kids and all of these, great ideas. But after the media stops covering the tragedy, it just kind of seems to be forgotten. It was very, very saddening that I did find very sad. But they did highlight a couple things that I found very interesting and really proactive. A couple states are incorporating mental health into the education as young as kindergarten.
Wow.
So they're teaching that it's okay to feel in both, male, female, whatever gender they have in front of them. They're teaching them that it's okay to feel, and they're teaching them how to express and identify their feelings, which is something that I find, I've seen in our community is lacking. So I found that to be a wonderful and just great implementation in, I want to say they said Australia was doing it, and one of the states here in the US. I thought that was wonderful.
I want to, I don't know what happened. I disappeared off the face of internet.
Okay.
I want to qualify why I wanted to show that, because everything that you're saying, Lupe, obviously everything that you're saying, because we don't pay attention to the underlying causes, or we don't pay attention to what happens before the tragedy until it's too late. I also want to say that I didn't want to show that as a pay attention because this is how, school shooters are born, bred or whatever. But because it focuses on the mom, it really is calling attention to the need for this kind of education and the need for this kind of support throughout K-12 into adulthood.
Yes.
And where's the money? People say, I don't know if it's a business thing or a school thing, but the whole idea of look at your budget, right? Whatever you're spending money on, if your budget will tell you your priorities. And so if states are not using money for this kind of support, like in the school that was highlighted, the schools that were highlighted in the film, then you don't really care that much about it. And you're okay with people dying, with children dying. Let's focus on that. From not just school shootings, suicide, where there's all of these different things that are affecting kids that we're saying it's for the children, but then when it comes down to it, the money's not being spent.
Right.
In such a way that's really supporting their mental health.
Yes.
And I wanted to show that film because of this statistic that you shared with me. This is just 2 million kids between the ages of 3 and 17 have been diagnosed. So this is probably, I'm going to assume, you can correct me, because they've been to see someone, right? So this is probably there's a lot going on. Yes. And so there are going to be so many more millions that don't have a diagnosis.
Yes.
Or that it goes unnoticed. That parents, a lot of the times we do get referrals from schools, which I do want to applaud our schools because we get so many referrals, and they're very much pushing and helping our families get in to see us. But we do have a lot of parents who are confused as to why they were referred, because their kiddo is the same as always. They don't see any difference in their kiddo. And I think that really highlights the age 3 in that statistic. And I think that we don't often think about toddlers or, young kids, 4 and 5-year-olds having depression. And it could be that they've always just had those underlying concerns, and they just went unnoticed until the school is like, this isn't quite
different.
This isn't quite what's typical. So maybe let's hand them over to the professionals to see what they can do or what they think. And it's I think that you had a very good point in saying these are only the kids that are diagnosed.
Mm-hmm.
So many go undiagnosed, unnoticed, or in even our experience, they don't get brought in until it's at its worst.
Like Columbine. Mm-hmm.
Mm-hmm.
Yeah. I think one thing that I'm kind of thinking about is like for us, our clients they have Medi-Cal, so that's what pays for their services. And, you know, now I'm going to start talking about managed care. It's about, it's about how we see your depression. That's what is paying for services. And the fact of the matter is some people implode. The depression that they're experiencing isn't, okay, I want to, I want my social relationships. Some people can just pretend to have good social relationships. And some people can still maintain their grades, but they're still very, very depressed. But if we can't show outward signs, then managed care, Medi-Cal, God bless Medi-Cal, won't pay for the services. And so, for example, Columbine, the Columbine kids there, I don't think that there were such active symptoms where someone would know we need to make sure to keep these kids off the lot. No one had their eye on the kids. And so that is something to be said about. I really don't know the history of the Columbine kids, but I'm sure they didn't see oodles and oodles of professionals who were able to see homicidal tendencies. And so, that's kind of what the problem is we have to dig a little deeper, especially with our kids. We have to dig a little deeper in recognizing their symptoms. One thing Natalie said is we really need to talk about how, in 3 minutes, how kids experience depression differently than adults do. And one way is the fighting. You'll see this with kids, that if kids fight a little more, we will naturally go to oppositional defiant disorder. They're being oppositional, they're being defiant, but sometimes they're fist fighting because they're having that inward struggle that they're not able to put words to.
Or even just talking back, or they're just irritable. Everything bothers them. When I breathe, it bothers them. They're always angry. And I think that was one of the things that I wanted to bring up earlier, is that anger is a huge red flag for depression.
Excellent.
That's something that parents and just everybody needs to keep in the back of their mind. They're not just being, jerks. They're not just trying to pick a fight. They're not going through that adolescent irritability phase. It could be depression.
So I'm going to go over a few more minutes because I do want to pull up the last as the whoops. I don't know why I'm having such a hard time today. Hang on a second.
You're doing great.
Okay, so here's the last slide that has sort of recommendations. And I think what you're saying about when there's the behavior starts to show up, here's some things that maybe we want to recommend or call attention to. Maybe I can make it a little bit bigger. So I'll just read through them, and then if you want to jump in. Right now, the whole screen is just the photos. So how to nurture a child's mental health, actively listen before offering advice, be patient, and validate theirs, tell the truth, model healthy behavior, be consistent and follow through with what you promise, believe them and in them, practice relaxation exercises together, recognize positive choices, set and respect boundaries, reach out and hug them, make play and exercise a requirement, view their behavior as a window to their needs and feelings, limit electronic time for everyone, have scheduled family time, respond calmly when their emotions are elevated, be present, model forgiveness, use open-ended questions, teach them how to be safe, surround them with healthy adults. Okay.
I think all of these are very, very important. The two or three that really stand out to me and that I find myself often having to recommend to families is being patient, because oftentimes, especially when your kiddo's being irritable or maybe disrespectful, we tend to not be very patient with them or listen to them. So patience is very, very important. Recognizing the positive changes. A lot of the time, all we really get from parents is the negative story, the negative history. And when we ask, what are his or her good qualities? Tell me something.
Yeah.
Tell me something they're good at. Tell me something good about them. And unfortunately, sometimes we have parents who are like, I don't know, there isn't anything good. And so I think that right there really just highlights one of the reasons why, or one of the underlying issues that is exacerbating these symptoms of depression, is they just don't feel good about themselves because they may not hear anything that's very good about themselves very often. The last thing that I find myself recommending quite often is spend time one-on-one with your kid. Get to know each individual child. I know sometimes life gets hectic and crazy. We have a lot to do. Everyone's very busy. But that one-on-one time, when your kid feels like you're investing time in them, you want to know them, you want to understand who they are as a tiny human, that really just does so much for their confidence, for their self-esteem, for just them as a whole. And think about humans as an emotional, overly complicated plant. We need sunlight, we need water, we need exercise and play, and that's all super important. So yeah, those are the ones that really stood out to me.
Yeah. Something that's sticking out to me as a clinician and as a parent also is we do have to model what we want to see our kids do, or and that's what we tell our parents. If you're going to blow up, you need to understand your kid is going to learn to respond the same way. They're going to emote the same way that you emote. So one thing that's sticking out to me is that we want to encourage our families to be emotionally healthy so that they can teach their kiddos to be, to also have good emotional health. So
that's where it stems from, where parents are asking if they can have their own sessions as well, because they're recognizing a little bit of themselves in their kiddos.
Mm-hmm. Yeah. Does anyone else have any connected this to anything that you've been doing? Maybe. As a mom, I agree. Kanuli, some of these I have to remember. I mean, just hugging your kids, right?
Yeah.
Mm-hmm. I often emphasize a lot the boundaries, because some of our kids are less than others. And so the way you respond to them is mindful of it. If you're angry, well, own it up as, hey, I'm angry. It's not you, it's me. So not projecting your emotions on your kid, because they internalize it. So being responsible for your emotions and not allowing them to, not allowing yourself to project them on your kid, being mindful of that. So that's something I emphasize a lot.
Yeah.
I'm a big proponent of telling the truth, even with children. And that's really hard for adults to do. I mean, we're talking about how we're, the model that we're setting for our kids. And I think a lot of times shielding kids from truthful conversations or truthful, I mean, I personally never, and I'm going to out myself. I personally never told my son that there was a Santa Claus. I never did that. Because the moment that I was confronted with that, I couldn't lie to his face.
Mm-hmm.
The second it happened and it was like, oh no, I have to decide if I'm going to lie and then pretend or if I'm just going to not do it. And
Yeah.
I thought about it for a second and then it came out and we talked about it and it was sad and then he got over it.
Yeah.
So yay, resiliency. I don't know.
Oh, absolutely.
Yeah.
Anyone else want to share a last thought about kids, your clients, before we close it out? Okay. So just a reminder, May is Mental Health Awareness Month, and this was our part 2 about depression. We're going to tackle anxiety over the next couple of weeks. And obviously this went a lot deeper than, last week was a really good overview of all the different ways that they can signal that there's depression, and then all the different ways that there's coping skills, and it was very surface. And this was with the stats, and then especially talking about kids and how serious this can get, because when we talk about Columbine, it can get very serious, and what it does to families and what it does to communities, and as a nation, how are we dealing with it? Thank you to the Henrietta Weill Clinic. Here's the website if you're looking for information, if you have any questions, there's contact information there. All the services are available there. And then if you have a more urgent need, there's the phone number, 725-1042. Please reach out. This is why we're here on Thursdays, Therapy Thursdays, for the community. Any last words, Kaduli?
Thank you, Letty, for bringing us on, and Delano Clinic. You rocked it out as always. Great job, Lupe, and all of you awesome team members. Thank you. Thank you. Thank you.
Thank you for the opportunity.
Yeah.
Absolutely. All right, everybody. We'll see you next week. Have a great weekend.
All right. Thank you. See you Thursday.